Well, thank you, Darren, for the kind introduction, and it was a really good chat yesterday. And well, thank you for the invitation. Thank you all and the organization. What I would like to show you here, it's the evolution of our collaboration, and this is really important to us, and what we think it's the best way to really collaborate in between North and South, decreasing the gap, as Maria has well said. So I will show you. Uh, that we know that this recent publish that we have a very uh, different publications regarding when we compare high-income countries and low-income, middle-income countries. You can see that 90% of critical care publications comes from high-income countries, and only 16%, the 16% of the RCTs are from high-income countries, and zero in this publication from low and middle-income countries. 28% of the high-income countries include LMIC, but the reverse, 60% of LMIC studies include high-income countries. So we have a barrier in that, and this is important to address. And then we, as researchers, we started our response regarding our Brazilian research network intensive care that was founded in 2007 by 9 investigators, and now we are 162 members, 40 in the scientific committee. We have published 15 randomized controlled trials and included more than 30,000 patients with 120 centers in 20 countries and 71 publications in high impact journal. But we know that we need money for that, and we need funding for that. And we really have the funding that can help us inside of our country that comes from the Ministry of Health. That's a program, a special program called PROADI, and this is developed for increasing our universal system healthcare, right? So how it works? We do have some philanthropic hospitals. We don't have that possibility of tax immunity for every hospital. That's maybe a criticism for the program, but that's how it works. So the hospitals that participate in the program, they can invest money from the tax immunity, and this money must go to research. So, and this is how we can really afford large multi-center trials. And this program, it's not only for randomized controlled trials. We do have some studies regarding regarding the assessment and incorporation of technologies, human resources, and also development management and operational techniques in health service. So we have 4 areas of investment, and that is really important. We do have 7 institutions that we call excellent hospitals, and 239 projects that has been approved. And as you can see, the number of projects has increased since 2009, and the number of patients has increased, and the number of investment money has increased as well. Then that's why we could then start a Renovate trial. That was a very important trial for us, and that's compare high flow to non-invasive ventilation, acute respiratory failure. And this was a question that was important because the device, the high flow availability and the resource constraints different substantially between the hospitals in Brazil. Majority of our public hospitals don't have high flow, and evidence from high income countries may not translate directly to low and middle income countries. Then this was I studied from BRICNet. I am one of the principal investigators from this study, but the money came from our Minister of Health, and that made us the possibility to commission Barry Consultants. That is a very known and statistical company from Texas that really helped us with the methodology, and we could not have them with us we wouldn't have money for that, and that was possible. So as you know, Renovate was a non-inferiority trial, was adaptive Bayesian randomized controlled trial using a methodology that's very modern, that's the same in REMAP-CAP, as we talked here before. We randomized 1,800 patients to high flow or NIV in emergency care or inside of the ICU. And the importance was that we wanted to study the five acute respiratory failure populations at the same time, right? So this was important because we would have one question to be answered for the whole population, and we could not do this trial if we did not have the methodology that Barry Consultants has helped us. So that one question, five populations, and that was possible because with the boring methodology, that could, as long as the population or the groups are similar, they can share information. So the smallest sample size of the smallest group that could share information with that group that has a higher sample size, and that means that you increase the number of sample size on that smaller group, and you also increase precision of the results. So we could save resources, we could save money, and that was very important to our system. So that's why we commissioned Barry Consultants, that we had a very good partnership. They really helped us, and it is a global reference in Bayesian adaptive trial, and they participate in the trial design, in the adaptive methodology, in the interim analysis, and even with the DSMB support. And Renovate also brought us some economic perspective using high flow. As you can see in the four groups that we have studied, it was cost effective in three of them, and only COVID-19 patients it was not cost effective because our mortality was too high, and also the patients stayed a longer time in the hospital. So that's why we have this results. And as you can see, the impact of the results was very important for our health system. Supply easier option of treatment than what we had before, better comfort for the patient and the patient's acceptance, possibility of use in different settings, ICU or ED, or even a ward. And it was cost effective and provide decision makers with information to support the public policy decisions. And as you can see, it was published in a high impact journal, and many citations, and with a very good metrics. And we were invited to present the trial basically all over the world, as you can see. And that was really important for dissemination of the results. And this is, is not, okay. But we have to do some homework that we haven't done, because we recently did a survey with Brazilian public hospitals, and we see that still most of our hospitals don't have high flow public hospitals don't have high flow device yet. And and there was another important thing to say about BRICnet, that with that support from our government, we could increase our methodological importance with our trials. For instance, we have published cluster randomized trials, 2x2 factorial design, adaptive multi-arm, multi-stage, and registry embedded platform, and that was really important to increase our acceptance in the scientific community. And that was so important that we have some great advances in our symmetrical collaboration, and that's what we want, to have a symmetrical collaboration. And recently we have been invited by the Practical Platform, and I am very pleased and very thankful to with Ewan and Eddie for inviting me for the steering committee. And BRICnet is participating in the Practical Platform, and especially in this TULIP pilot trial that's we're trying to look at this the neuromuscular blocking agents in patients in mechanical ventilation. This is a pilot RCT, but the importance is we were invited right by the beginning. So we are principal applicants with everybody, and with our submission, we are responsible for that as well. And I am now one of the participants of the Practical Steering Committee, and this is very important for the symmetrical collaboration. And then we also want to increase our collaboration south to south collaboration, and this is happening with this study that we call the GS-WIN. That it hasn't started yet, but it's characterization of the winning practice in the south part of the world, how they do it, and it's on the regulatory phase, and probably will start until the end of this year. So the motto is to have independence regarding a network and access to expertise depending on funding. That's it's very important, and doing asymmetrical leadership. And so the evidence that we need must for our ICUs must also come from our ICU, and Brazil has demonstrated that's possible, and I am very thankful for considering us in a symmetrical way. Thank you very much.